Hi everyone, this is Dr. Ansari. I'm going to be talking to you today about recurrent urinary tract infections that I'm going to be shortening as UTIs, urinary tract infections. Let's talk about the definition of recurrent urinary tract infection. Recurrent urinary tract infection is defined by 3 or more positive urine cultures in 1 year. Alternatively, it could be 2 positive cultures in 6 months. Okay. This is important because when I see patients who tell me they keep getting infections, and I have no proof of it, I can't say that you actually have urinary tract infections because there are other medical conditions that cause the same exact symptoms as urinary tract infections. The urinary frequency, urgency to go. You can get burning with urination. Okay. You can get lower abdominal pain, and you can have blood in the urine. Okay, these are very common symptoms of urinary tract infections. Sometimes you can have some nausea, vomiting along with these things, or fever along with one of these or 2 of these types of symptoms. But these are the key symptoms that we use to do further testing. What's important here is that they must be urine cultures. Right? What's a urine culture? A urine culture is when we grow the bacteria in a petri dish. Remember, maybe science class in high school or college, you'd have a petri dish and you'd put something in it and then it would grow out some bacteria in little dots. Okay, that's a culture. We literally send it out to do this. It can take 3 to 5 days for a result to come back. You need a culture in order to meet the criteria of having recurrent urinary tract infections. Okay? This is not the same as a urine analysis, which is an office test. So if your doctor comes in and says this, as soon as you come in, they take the urine and they say, hey, yeah, you got a urinary tract infection. Within the same visit, that means they did a urine analysis, just an office test, because the culture takes 3 to 5 days. So ideally, what should be happening, it doesn't always happen, doesn't always have to happen, but if you get frequent urinary tract infections, at that point, your doctor needs to be sending urinary cultures to figure out, 1, is it truly an infection, and number 2, which antibiotic is going to treat it, because a culture will list all the antibiotics that are commonly used and how it worked against these little bacteria. So within the specialty of urogynecology and urology, we rely on urine cultures in order to treat patients with urinary tract infections. And the issue is with antibiotics. Okay, antibiotics are great medications to cure infections. However, antibiotics, if they're given frivolously, just willy-nilly, or someone has recurrent urinary tract infections but no cultures, you're increasing the risk, number 1, of side effects if you're getting the wrong antibiotics, or if you don't have urinary tract infections and you're getting treated repeatedly with antibiotics, that's no good either. So increasing side effects and complication rates. and also increasing something called resistance. So over time, the bacteria in your body will become resistant, meaning no longer work or no longer be able to, the antibiotic will no longer be able to work with those bacteria in the body. And that is really bad when we run out of antibiotics to treat infections. And yes, that is happening worldwide, where we're running out of antibiotics. So that's why cultures are so important, so that we're not just randomly giving you any old antibiotic. We're actually using something very specific because it's been typed. The bacteria has been typed because we ran a culture. If your urine culture comes out positive after 3 days or 5 days, and we know exactly which antibiotic to give you, great, then you get treated, okay? And what if your culture comes back negative, okay? So if there's a positive, you get treated. If it's a negative, no bacteria growth, then what happens? Well, then we might be dealing with another condition that might be interstitial cystitis or painful bladder syndrome, or maybe it's vaginal atrophy, thinning of the skin if you're in the postmenopausal state. Sometimes that can cause very similar symptoms to urinary tract infections. Just click on the top box that has an eye located on it on top of your screen to connect with videos about interstitial cystitis if you have been getting cultures and they've been negative. So this will go over the other issues that look like urinary tract infections but are not. The next video is going to go over treatments that we use for recurrent urinary tract infections. Thanks.